HIV test has to be mandatory for the people those who are going for surgery, one. People those who are having unprotected sex, two. All sexual workers should have an HIV test. HIV और AIDS को समाप्त करने के लिए सिर्फ awareness is the most important thing. In India, it is towards northeast more, where the sexual practices are unprotected. HIV is human immunodeficiency virus. AIDS is a disease. Haiti is a place from where homosexual, Homo sapien, and you can say Haiti. So 3H. So that is why they said human immunodeficiency virus. So this virus is human immunodeficiency virus. It's nothing like it. It's a virus. It is a retrovirus transforming the AIDS response. Now this means together we fight and together we transform.
Hello, Dr. Anil Gomber ji. Welcome on the World's AIDS Day. What we have got to know that according to the latest India HIV estimate in 2023 report, around 2.5 million people are living with HIV and AIDS in India, which was in 2021 estimates places the number was approximately 2.24 million. तो ये surge हुआ है, AIDS बड़ा है इंडिया में. What is the reason behind it?
Yeah. First of all, thank you very much, Mr. Pratik, for calling me here on World AIDS Day. That's the 1st December. And basically, World AIDS Day is being celebrated all over the world with some theme. And that theme today is overcoming disruption, transforming the AIDS response. Now, this means together we fight and together we transform.
Which are the key states in India with the highest HIV prevalence?
Basically, Northeast, I suppose.
Okay.
Because there, I think the education is also not very much there for
but
HIV.
Literacy level is high in Northeast?
Quite high,
Yes.
high. We cannot pinpoint that this area is there. That is wrong to say. It is present all over the world.
Right.
In India, it is towards northeast more,
Okay.
where the sexual practices are unprotected.
Okay, how can we strengthen early HIV testing and linkage to care to reduce undiagnosed cases in India?
Yeah, that's what I'm saying. HIV test has to be mandatory for the people those who are going for surgery, one. People those who are having unprotected sex, two. All sexual workers should have an HIV test at every time after every 3 months to 6 months. They should have a certificate of that they are HIV negative. When you go to any other country like sometime in the Southeast Asia do have a lot of HIV positive. And when you go to them, and all sexual workers do have a certificate that they are not suffering from HIV.
Do we have in India, like Delhi, we have red light area? Do these sex workers have these facilities where they are?
It is mandatory. It is mandatory. It is mandatory. It is unlawful if you are having a sex without a sexual worker. Do not have a sex certificate of HIV.
What support services, mental health, nutrition, legal aid are essential for holistic care of people living in with HIV and AIDS?
You know, HIV is producing immune deficiency. The name of the virus is also, the disease is also called as acquired immunodeficiency syndrome, AIDS. What is the full form of AIDS? Is the acquired immunodeficiency syndrome. So it means you are acquiring immunity less. You can say immunity deficiency syndrome. Now, once you have a less immunity, you can acquire certain unusual infections, viral infections, bacterial infections, fungal infections. So you will acquire candidiasis, which is not common. So many fungal infections which can be found unusual sites also. Sometimes there is a encephalitis, Kaposi sarcoma. This is an unusual cancer of the skin.
Okay.
Yeah, people do have a lot of other unusual infections where there is immunity is less. So that is why we should know the people, those who are young people, those who are sexual workers, those who are high risk group. Suppose if you have a high risk group, then you must get that tested. If at all it is not to be tested, then certain signs are there. You can lose your teeth, you can lose your hair, you can have a skin infection. You can have a fungal infection, you can have chronic cough.
Okay.
Pneumocystis carinii is another infection which is quite common in HIV people. So once you have an HIV positive, it doesn't mean that he is going to spread that, but we should know the viral load. in that patient also, in that person also. If viral load is below the permitted values, then one can have a safe sex also, safe procedures also. But if you have a viral load less than a certain limit, then only you should try to make them as normal.
अच्छा, भारत में HIV और एड्स को की संख्या को कम करने के लिए सरकार क्या कर रही है?
सरकार काफी कदम उठाए हैं,
जो स्वास्थ्य संस्थाएं हैं वो क्या कर रही हैं?
सरकार ने काफी कदम उठाए हैं. I know that when I was in 1993, I started the program of AIDS awareness. People never used to know what is AIDS, basically. What is HIV? Actually, now people are able to know what is HIV, because after that, all hospitals, all medical personnel, all health authorities know what is HIV. At least. So, at least the awareness has spread. But we need to continue this awareness. The responsibility of every person should know that if they are going for some blood transfusion, if they are going to give blood donations even, if they are going to have some surgeries, if they are going to have something like a red light area, as you said it, they should understand they can spread to other people also.
क्या हमारी भारत सरकार एड्स HIV को रोकने
के लिए आप कंप्लीट सेक्सुअल प्रैक्टिसेस, प्रोटेक्टेड सेक्सुअल प्रैक्टिसेस समझाइए. उनको ये बताइए कि सेक्स करने के लिए आपको कंडोम भी यूज करना है. यू कैन हैव ए डबल कंडोम यूज इफ यू आर नॉट एबल टू डू दैट. नॉट सिंगल, यू कैन टेक डबल कंडोम. You can have sexual education to the female also, because it is normally spread by sexual contact,
right?
Either by semen or by vaginal secretion. So they should know that if they are spreading, they can spread it to their own partner also.
Right.
So that education, sexual education, should be started. And I tell you, Government of India has done sexual education in schools must.
What is NACO's responsibility in this? और NACO इसमें क्या कर रहा है? क्या NACO कितना
NACO का ये है कि वो स्प्रेड करे एक मैसेज कि हम कैसे ट्रांसफॉर्म कर सकते हैं, हम कैसे सेग्रीगेट कर सकते हैं, और उन लोगों को समझाया जाए कि हैंड शेकिंग से, किसिंग से एड्स नहीं फैलता है. People think that I am shaking hand, so I will get HIV. No,
eating with you.
There are certain myths and facts about it.
Okay.
They should know what are the myths and facts about the AIDS. And every student now at the class of sexual education, they know it. Now they know it, but at least in Delhi they know it. Yes, now you have to percolate down to the society, to the smaller cities also, that AIDS is being spread by unprotected sex, done by blood to blood transfusion, either by sex or by blood transfusion or by any surgery, unknowingly by drug addicts also. Then they are taking the needles and syringes which are unsterile. They can spread that. So drugs, addictions, all addicted people should have a test of HIV.
अच्छा, माँ से बच्चे में HIV संक्रमण को रोकने के लिए भारत में कौन से प्रोटोकॉल और दवाएं उपयोग की जा रही हैं?
एंटी रेट्रोवायरल ड्रग्स आर अवेलेबल. आजकल दवाइयां हमको, जैसे सेक्स किया आपने, 24 घंटे के अंदर कुछ दवाइयां ऐसी हैं जो आपको प्रोटेक्ट कर देती हैं कि वो जो बाई चांस वायरस गया भी है अंदर, मेल के या फीमेल के, वो खत्म हो जाए 24 आवर्स के अंदर. सो जस्ट आफ्टर डूइंग ए सेक्सुअल एक्ट you can have those drugs pre-determination, and then you can have sex up to 72 hours also. There are certain drugs which can reduce the viral load up to 72 hours. But it is not much that it is going to stop everything. But yes, we do have these drugs. We do have antiretroviral drugs now, which are quite authenticated and which has reduced the viral load in people, and people remains normal for number of years, and people remain in remission. People ठीक हो जाते हैं, बिल्कुल ठीक हो जाते हैं. और लेकिन उनके अंदर एक टैबू हो जाता है कि भाई अब मैं मेरा वायरल लोड कितना. तो वी नीड टू सी वायरल लोड इन दैट. देन देयर आर सर्टेन काउंट्स, CD4 काउंट, CD3 काउंट्स. वी शुड सी दैट इम्यूनिटी तो नहीं कम हो रही. तो कुछ कैंसर्स होते हैं which can be seen on the skin also. That is, as I said, pneumocystis carinii, hair in lungs. When recurrent cough is there, is not getting relieved by all sorts of antibiotics, people should know that they might suffer from these diseases.
HIV एड्स के प्रति समाज में व्याप्त भेदभाव को कम करने के लिए डॉक्टर और स्वास्थ्य कार्यकर्ता क्या कर सकते हैं?
HIV और एड्स को समाप्त करने के लिए सिर्फ अवेयरनेस इज द मोस्ट इंपॉर्टेंट थिंग. हेल्थ अवेयरनेस ऑन एड्स, दे शुड नो, एज आई सेड, उसकी मिथ्स एंड फैक्ट्स अबाउट इट, कैसे उसको रोका जा सकता है, कैसे उसकी चेन को बंद किया जा सकता है. ऑल हाई रिस्क ग्रुप्स शुड नो दिस. जो ब्लड ट्रांसफ्यूजन बार बार लेते हैं, थैलेसेमिक पेशेंट्स हैं हमारे पास,
ओके,
वो बार बार ब्लड लेते हैं.
blood
एंड लॉट ऑफ थैलेसेमिक पेशेंट इन द रीसेंट टाइम्स आल्सो people have come out to be HIV positive
thalassemia
because they are taking blood from the outside.
Okay,
We do not know from where the blood is coming. So blood banks.
okay, how do co-infections like tuberculosis or hepatitis affect HIV management, and what integrated approaches are recommended?
Yes, anti-tubercular treatment, those people are already on anti-tubercular treatment, those people are already having chronic coughs, those people are in tubercular hospitals,
Right.
they are more prone for HIV. So, and even HIV people are more prone for hepatitis, for tuberculosis, and for any other fungal infection. So, all these people, those who are having immune deficiency, those who are having chronic immune deficiency, those who are having, you can say, very cachexic, loss of fear, loss of appetite, sometimes mentation is also not proper, they should be relegated to all these investigations. Immune deficiency in any of the things, people will have other infections. मैं बहुत पतला हूँ, मेरे पास अंदर दम नहीं है, मेरे पास अंदर वीकनेस बहुत है, मैं कमजोर हो रहा हूँ, unexplained. I'm not suffering from diabetes, I'm not suffering from hypertension, I'm not suffering from any other chronic disease, but still I'm losing my weight. Weight loss is there, hair loss is there, teeth loss is there. You can have a mentation, cognitive functions are also getting disturbed. So all these people are having immune deficiency, and these people can acquire all the infection from the environment, bacterial infection, all bacteria, viral. So they can spread from that place.
अच्छा, आप ये बताइए कि आने वाले समय में जो 2.5 बिलियन जो फिगर आ गई एड्स की, ये कम होगी या क्या होगा इस मामले में? और इसमें भारत सरकार, नैको और HIV एड्स कंट्रोल वाली ऑर्गेनाइजेशंस कितना महत्वपूर्ण है?
National AIDS Control Organization is doing its own work, but it is our duty, all the duty of the people, me, you, everybody has a duty to know about this disease, in which condition they are going to spread, and at least in younger people, we should educate. Education. On these terms, I will say that after the sex, you are taking one medication. That is not education. That is, you are going to protect it from your own self. But you can even spread it by sexual contact to others. So education is very important. Then you should know who are the people, those who should be educated first.
तो ये हमारी फिगर कम आएगी या और बढ़ेगी?
आएगी तो सही, ऐसा नहीं है. When America had these type of cases, America has almost eliminated
AIDS, HIV.
Almost. But I don't say that zero.
So what do you say? What is the difference between HIV and AIDS?
HIV is human immunodeficiency virus. AIDS is a disease.
Okay.
It's a conglomeration of certain symptoms, signs and symptoms of the disease.
Right.
Certain diseases, different diseases in your body has been taken as acquired immunodeficiency syndrome. This is a syndrome.
So America has finished HIV.
HIV and AIDS we cannot differentiate. HIV is a virus. It's a virus. This virus is producing problems in your body.
Immune
Either
system.
eyes are getting problem, ear has problem, lungs are getting problem, kidneys are getting problem, your chest is getting problem. So all these, once you get into an AIDS means there must be something like combination of certain diseases. So all this can happen in one patient. It doesn't mean that patient is only suffering from chronic cough. No, patient might be suffering from Kaposi sarcoma. Patient might be suffering from cognitive dysfunction. Patient might be suffering from loss of hair, loss of appetite, loss of you can say weight.
Okay.
Yes. So AIDS and HIV go together. Basically, HIV producing AIDS.
Right.
HIV is a virus. The peculiar history of HIV is that it has happened sometime in 1983-84. It was never, you never believe that it was not there in my forefathers' fathers.
Right.
So how it has happened in this is a disease of the newer ones. You know, some of the people in Haiti, that is in America, actually some of the people were dying unknowingly. It's just a history, small history. If you want to know about it,
In a brief.
if you want to know about it,
briefly.
Okay, briefly. Haiti is a place from where homosexual, Homo sapien, and you can say Haiti. So 3H, those people used to die in the hospital. People used to come with a high-grade fever, with fevers, unknowingly weight loss, and all sorts of AIDS symptoms and signs. And they were dying, and they were not able to know. Americans were very baffled. What is that disease called? It's called viral disease, some viral disease. What is that viral disease? Where there is a deficiency of immunity. So that is why they said human immunodeficiency. Virus. So this virus is human immunodeficiency. Well, it's nothing like it. It's a virus. It is a retroviral. So from there, people were thinking that it has come from in the younger people, homosexuals. They were dying. So suddenly, all homosexuals were dying. So they thought there is something, a sexual contact is coming from the sexual contact. So that is why the researchers came and all that, and all over the world it was there.
Okay. Thank you, Anil Gomber.
Thank you.